The COVID-19 death toll in South Africa has increased by 8. A total of 777 new COVID-19 cases has meanwhile been identified in the country. The recovery rate currently stands at 95%. Active cases have dropped to below 22,000. The number of healthcare workers vaccinated under the Si-sonke Protocol is more than 269,000. Now, health expert and chief executive of Proactive Health Solutions, Dr. Fundile Nyati, is on Zoom to share some insights on how this Easter weekend celebrations and gatherings are likely to affect the COVID-19 trajectory as we now know it. A very good evening to you, Dr. Nyati. Thank you so much for joining us. Welcome to the Globe.
Good evening to you and good evening to the viewers.
The Easter weekend has now drawn to a close, Dr. Nyati. What has been your observations in terms of, people behavior with regards to following the protocols of COVID-19?
Well, I think it's been a mixed bag. Mixed bag in the sense that, I think the good thing, massive churches like the ZCC and others that normally draw thousands and millions of people, they did not have their annual gatherings during this time, because the regulations as they are just not practical for them. So I think that's a positive. But also a number of churches that did, observe, the period, they actually followed the regulations. But having said that, there's quite a number of other, gatherings and churches and even social gatherings where people just disregarded the whole thing about COVID-19 as if it has passed. There is a place in Durban that's called Ayadini Land. If you look at their videos over the past weekend, there hasn't been any masking, there hasn't been any social distancing. In Soweto, a number of places, they had street parties where SAPS had to be involved, and also we had places, some taverns around here in Joburg, where they even had the audacity to torch an SAPS van when they were, when the SAPS went there to actually tell them that they're contravening the laws. So you still have a small percentage of South Africans who are actually putting the rest of us at risk by not doing what they're expected to do. And what is even worse, this particular tavern is alleged not even have a license. So we really have a problem of, people who are just not prepared to abide by the laws of the country. And I think we need to really ask ourselves some questions as South Africans, because it's not only about yourself getting infected, but also about other people who may get infected because of the super spreader events within, your area of influence.
But do you think the partial alcohol ban, Dr. Nyati, did help in a way to sort of curb the infection rate here in South Africa? And if so, do you think it should be used as a panacea moving forward to curb further infections?
And in the short term, I think there is an impact, because if you look at the trauma, because that's just another indirect indicator of how things are going. If you look at the trauma cases in the various hospitals, we are told that things are not as bad as they used to be or they can be. So it means there is some impact, although some people actually stocked up long before the regulations were put in place. But there is some positive. But I think as South Africa, we need to go beyond just these short-term measures and look at our relationship with alcohol. Why is it that our people have got this bad, relationship with alcohol that leads to binge drinking, disorder, and putting other people's lives, I think it's something that we really need to look at in terms of the medium to the long term. But in the short term, yes, there is benefit for the partial ban.
Now, key data shows no signs of a third wave as the Easter weekend draws to a close, because this weekend was actually feared to be, to be the catalyst of super spreaders of the COVID-19 infections. Now, but then this is a dangerous observation, Dr. Nyati, don't you think? Because people would think that we are out of the woods and then would then slip to reckless behavior.
Well, I think it's too early to actually celebrate and say things, we haven't had anything. Remember, there is an incubation period. which can be anything from 2 days to 14 days for people to actually manifest if they've been infected. So we are still in the Easter weekend right now. So people who get infected now may manifest a week or even longer from now. So for me, I would say before we make that kind of bold, assessment, let's see what happens in 2 weeks from now. But like I said, what I've seen in some of these events, like the taverns and other places like the AR lounges, we need to see what's going to happen. There are already cluster infections. There's been reports, especially around the University of Pretoria, where there has been, I think, over 100 students, I think 118 if I'm not mistaken, who have been found to be positive, an increase of almost double from about 50-something just a few days ago. So the young people, once again, seem to be, going out of their way, getting to have fun, forgetting about COVID-19. And the risk relating to that is that when they go home to their parents or grandparents, they are spreading this infection. And so for me, the next 2 weeks is going to be very, very important for us to be, to look at those cluster kind of infections so that by the time we get to the winter, which is the middle of May, we have control for the kind of infection.
But on a general perspective, Dr. Nyati, how does South Africa fare with, compared to the rest of the world in terms of enforcing the lockdown restrictions, in terms of vaccinations and just generally, curbing the spread of COVID-19?
Well, I think in spite of all that I've just said now about people who are not necessarily adhering to the non-pharmacological, interventions to decrease COVID-19 spread, we must pat ourselves in the back by saying, things could have been worse. If we look at developed countries like France, UK, Germany, they have just had their spring now, and they are looking to go into their summer. They are on strict lockdown as we speak. They are ahead of us when we look at vaccination, because using what we call vaccination nationalism, and the fact that they are richer and they were able to get countries like, the Southern Hemisphere, they are in trouble. We struggling to get vaccines. We are not in the same boat as them, but that should not make us to think that we're out of the woods, because the only time where we will turn the tide, in a sustainable way is when we have a high percentage of South Africans that have been vaccinated. And at this moment, I'm a bit worried about whether we'll be able to meet our targets, come the end of this year. But whatever happens, it's important that we prioritize, those who are more at risk, the older people, the people with comorbid disorders, and we've made some ground, not, on the healthcare workers, although we still have almost about 1 million that still need to be vaccinated. But let's not get to a false sense of security just because we had only 777 new cases yesterday and only 8 deaths yesterday. This can change very, very quickly.
And just picking up on that point with regards to vaccinations, Dr. Nyati, people think that when you are vaccinated, you are actually becoming immune to infection and the fact that you cannot reinfect or infect others. So is this fact or fiction? Because I suppose we're treading on murky waters, and I think that the health authorities are not doing enough to educate people to let them know that, being vaccinated does not make you immune to reinfection.
I fully agree with you. I mean, if we look at all the vaccines, that have come up, there's plus minus 9 vaccines now that are being used across the world. Now, there is the concept of sterilizing, type of vaccination. Vaccination where you have immunity, but at the same time, you don't get to infect other people, you don't get infected. Now, we need to be very clear that as we get vaccinated, we are getting the artificial immunity. But that does not mean we are not getting, the infection. So we may not getting sick because we are vaccinated, we've got immunity, but we may still be passing the virus to others, more like carriers. So therefore, it's important that even if you are vaccinated, you make sure that you use the mask and socially distance to make sure that others who may not be having the artificial immunity that you have are protected from you, even if you may not get sick from the disease itself. It's a message that I think needs to come out. I've been saying it many times that public health education around issues of COVID-19, and more especially with the vaccination situation, needs to be stepped up, because for as long as we don't do that, then the conspiracy theories and the anti-vaxxers that are flooding the social media platforms are actually continuing to scare people and continuing to make people to actually think twice about vaccination, which is something that we do not need.
And I've been asked so many times, and I've been battling to find answers, as I'm no health expert, that vaccination, what is the point then of vaccinating if it won't protect me from infection? How would you respond to that?
I think we need to be very clear. What is the purpose of vaccination? The purpose of vaccination is that the person who is vaccinated gets to be given a germ or part of the germ that they have not yet interacted with, so that they develop immunity to fight that germ before the real germ comes in. That's the primary purpose. The secondary purpose is the fact that, at a certain point when many people have been vaccinated, then you have that community, immunity or population immunity that we've been talking about, the 7% situation. So the benefit to individuals is there. The benefit to communities is there. What we cannot say at this moment is that because I've got immunity from the vaccine, I may not be a carrier. That's the only part. And the vaccines that we have so far do not eliminate that possibility. But you do get immunity. And remember, none of these vaccines give us 100% immunity. The best gives us 94, 95% immunity. But rather you have that than not have anything at all. So, and even if you do get infected, it may be very mild compared to what it would have been without the vaccine.
Dr. Fundile Nyati, great chatting to you. Thank you so much for your time. We always appreciate your thoughts and your analysis on these matters. Thank you.
Thank you very much.